Alex was causing trouble?
She would be in the back of the class whispering. She would reach around this blue backpack of hers, take something out, and shake someone's hand. Then she would move on to the next kid.
Did you ever do anything about it?
Well, confrontation is not really my forte, so it took a while for me to work up the energy to talk to her, but I eventually told her that she needed to stop messing around, or I would fail her.
When was this?
Around February of 2013.
Did Alex Weaver do as you asked?
No, all my warnings fell flat. In fact, she did the opposite.
Did Alex Weaver's behavior ever improve?
No, it seemed to get worse. She would often be asked to be excused to go to the nurse's office or the bathroom.
Do you remember if Alex Weaver was communicating with any students in particular?
She spent the most time with Jason Johnson.
Did you ever see Alex Weaver dealing drugs?
No, I couldn't tell what she was doing in the back of the class. Well, except for one time in February.
What happened on that time in February?
Well, she was whispering and reaching around her backpack as usual, and then she pulled out a whole stack of bills.
Thank you, nothing further.
Cross-examination?
Yes, Your Honor.
May I proceed?
May.
You didn't like Alex Weaver, did you?
Alex was one of my students. She was a really talented musician.
Objection, Your Honor, non-responsive.
Which is sustained. Answer the question.
You didn't like Alex Weaver, did you? Yes or no, please?
I did.
Objection, Your Honor. Creation of a material fact. If I may direct the court's attention to page 38. Line 31 to 32. I never had a good feeling about Alex.
Counsel?
Your Honor, the fact that she never had a good feeling about Alex doesn't necessarily mean she didn't like her as a person.
Objection sustained.
In fact, you thought Alex's behavior was just bad in general, right?
She would misbehave in my class.
She wouldn't turn in assignments.
No, and she didn't show up for class a lot of the time.
You even threatened to fail Alex if she didn't stop this bad behavior. Isn't that right?
That's true.
Now, Jason had been a good student, hadn't he?
Yes, up until his senior year.
Jason started to slack off in senior year, right?
Yeah. It
And
was,
Jason's behavior started to change, especially once he hit senior year.
yeah, it might have been the senior slump, but it was also around the time that Alex Weaver came to school.
But it might have been the senior slump, right?
Yes, obviously, yeah.
Yet you concluded Alex must have been taking drugs. Isn't that right?
I didn't conclude that. It seemed to me that it kind of seemed sometimes he was on something, but
You concluded that Alex might have been on something.
yeah,
But you're not an expert in drug recognition. Isn't that a fact?
of course not.
Now, Miss Perkins, earlier this year you held auditions for lead drummer art in the spring marching band competition. Is
Yes,
that right?
for our award-winning marching band.
And the auditions were for major solo parts, right?
Yes,
Isn't it a fact that both Ray and Alex auditioned for these parts?
they did.
And when Alex and Ray auditioned, who didn't you choose?
Well, I didn't choose Alex.
No further questions, Your Honor.
Redirect?
Your Honor.
Miss Perkins. Miss Perkins.
The defense calls Dr. Casey Perkins.
Casey Burke. Please raise your right hand. Do you solemnly affirm that the testimony you are about to give will faithfully and truthfully conform to the facts and rules of the mock trial competition?
I do.
Please state your name and spell your last for the court record.
Dr. Casey Burke, B-U-R-K-E.
Thank you. You may be seated.
Before I begin, I'd like to ask for a time check.
The defense has 8 minutes and 12 seconds remaining.
May I proceed?
May.
Good afternoon, doctor.
Good afternoon.
Doctor, what do you do for a living?
Right now I teach at the Dawkins DeKalb Medical School in Spring County, next to Rosewood.
What sort of background do you have in medicine?
I earned my medical degree from Ohio Medical School, received certification in forensic pathology, and worked for 25 years in the Spring County Coroner's Office.
Have you ever been published in your field?
Definitely. During my time at the Coroner's Office, I published The Pathology of Drug Abuse, which is today used nationwide to teach the fundamentals of forensic medicine.
Well, how are you involved in this case?
I was brought in pro bono to review the conclusions Dr. Sanchez made regarding Jason Johnson's cause of death and present my findings in court today.
So what information did you have access to during this review?
I had Dr. Sanchez's autopsy report and the decedent's medical records.
Okay, let's walk through what you discovered. First, what were Dr. Sanchez's conclusions?
Dr. Sanchez wrote the traces of Adderall found in the decedent's system were responsible for his death.
Do you agree?
I don't. Jason Johnson only had trace amounts of Adderall in his system. The figure Dr. Sanchez supplied, about 40 milligrams, falls within a normal prescription range for Adderall. That's not nearly enough to be toxic, let alone cause death.
Well, could you explain how having 40 milligrams of Adderall in your system would not be toxic?
Sure, imagine you have a glass of water. If for you to fill that glass with red paint and drink it, that would almost certainly be toxic. However, if you were to then take that glass of red paint and pour it in, say, one of the Great Lakes and drink their water, the chance that you'd be poisoned becomes minuscule. In fact, it was such a minute...
Objection, Your Honor, narrative.
That's your next question.
Okay. So, if you don't think Adderall caused Jason Johnson's death, do you have an opinion on what did?
The decedent consumed a startling amount of alcohol.
How much alcohol is a startling amount?
See, we can't be positive exactly how much. The decedent was reported as having a blood alcohol content of 0.05, but that was only recorded once he was in the emergency room. Time changes some with BAC.
What does that mean?
As time goes by, the human body sobers up and our BAC decreases. A blood alcohol content that's 0.05 at 9 a.m. could have been 0.15 at 6 a.m. or
Objection,
even
Your Honor,
higher.
speculation.
Counsel?
Your Honor, Dr. Burke is a qualified expert witness. As said in the stipulations, he's able to testify to blood alcohol content in alcohol and how it affects the body.
Your Honor,
The question is speculation, so if you could address yourself to that objection.
Yes, he is not speculating because he is qualified and is able to make statements and to offer his own ideas in terms of what happened.
Your Honor, the witness did not even conduct an autopsy on Jason's body. While he's maybe a qualified expert, he is hardly qualified to speculate.
Objection overruled.
So rather a 0.05 or 0.15 blood alcohol content be enough to cause death in a typical teenager of the decedent size?
No, Jason was not a typical teenager though. Based on my review of his medical records, Jason Johnson had a heart defect called hypertrophic cardiomyopathy. This could ultimately block blood flow back to the heart.
How does alcohol consumption connect to that heart defect?
Drinking too much alcohol decreases the volume of blood that actually makes it back to the heart. Between the heart defect blocking blood from getting to the heart and the alcohol thinning out the blood that actually makes it back, the decedent wouldn't have had enough blood in his heart to function.
Doctor, what is your ultimate conclusion about Jason Johnson's cause of death?
Jason Johnson died due to a lack of blood flow to his heart, induced by a pre-existing heart defect and alcohol, leading to his heart attack. The minuscule amount of Adderall that the decedent consumed had a tiny or negligible effect.
Thank you, doctor. Nothing further on.
Well,
Yes, Your Honor. May I be heard? Dr. Burke, did you ever perform an autopsy on Jason?
I did not. I was brought in to review Dr. Sanchez's reports.
So you never actually examined his body?
No, I didn't.
Now, Dr. Sanchez's autopsy revealed that when Jason died, Jason had both alcohol and Adderall in his system. Isn't that correct?
Yes,
And Dr. Burke, you believe that the concentration of Adderall in Jason's system was low compared to that of alcohol. Isn't that correct?
I do.
Rather, it was the alcohol in Jason's body that put so much stress on Jason's heart, he experienced cardiac arrhythmias. Isn't that right?
Yes,
And it was these arrhythmias that led to Jason's heart attack.
yes.
But isn't it a fact that the level of alcohol in Jason's body was much lower than the usual concentration seen in alcohol poisoning and other alcohol-related deaths?
At the time that the blood alcohol content was recorded, it was much lower, but we can't know exactly how high the peak was.
Dr. Burke, Dr. Sanchez's autopsy found 40 milligrams of Adderall active in Jason's system. Isn't that correct?
Yes,
And you believe that a 40 milligram dose of Adderall is within the range of an average daily prescription dose.
I do.
But isn't it a fact that Jason did not have a prescription?
That is true.
Instead, Jason had a severely advanced case of hypertrophic cardiomyopathy. Isn't that right?
He did.
And such heart-related defects are considered rare among teens Jason's age. Isn't that so?
Yes, pretty rare.
Therefore, considering how young Jason also was, Jason would not be considered your average patient. Isn't that right?
I guess not.
So in Jason's case, even an average dose of Adderall would not have been appropriate. Isn't that right?
Can you repeat your question?
Even in Jason's case, considering how young he was, he had a heart defect, even an average dose of Adderall would not have been considered appropriate.
I think it would have been.
You believe it would have been?
Yes.
Okay, Dr. Burke. Now, alcohol can increase the effects of the amphetamine and Adderall. Isn't that right?
Yes.
And isn't it a fact that this increased effect could lead to a sudden narrowing of a coronary artery or a vasospasm?
That can happen in severe cases.
And isn't it possible that Jason's arrhythmias were caused by a coronary vasospasm rather than alcohol? Yes or no, please?
It's possible.
Yes, it is. You've been working at the Spring County Coroner's Office for 25 years, isn't that right?
Yes.
And in all that time, you worked in pathology as an assistant coroner, isn't that right?
Yes, I did.
And besides teaching and writing books, do you still practice pathology, Dr. Burke?
Yes, as a
2
hobby.
minutes.
As a hobby?
Yes.
So, Dr. Burke, do you scour cemeteries for dead bodies to examine?
No.
How? Are you retired, Dr. Burke?
Yes.
And how long ago did you retire?
3 years ago.
Thank you. I don't have further questions.
Thank you. Good work.
Yes, Your Honor. May I proceed? Doctor, do consultants such as yourself typically form accurate scientific conclusions without examining a physical body?
Absolutely. What we do is we cross-reference scientific reports with medical records and explore the relationships between noted symptoms and pre-existing medical conditions. When our conclusions are inaccurate, it's usually because the original examiner, in this case Dr. Sanchez, failed to note important details.
Would the amount of Adderall found in Jason Johnson's body be enough to cause death?
No. The amount of Adderall was such a low concentration that it's highly, highly unlikely.
So what did cause Jason Johnson's death?
The alcohol, in my opinion.
Thank you. Nothing further, Your Honor.
Thank you.
Evidence be excused.
Any other witness?
Yes, Your Honor, the defense counsel, I